Speak to any patient who's visited an ER in Saskatchewan, Mr. Speaker, will know this government is not making progress. The government's own documents say ER waits have not substantially improved. And now the Premier has quietly, very quietly walked away from the commitment that he very loudly made to Saskatchewan people. And he can laugh all he wants, but that is cold comfort to the many people who are going to emergency rooms who need care right away.
Many schools in our province are struggling because of massive enrollment increases that this government stubbornly refuses to fund. This is Sask Party neglect, and all of our kids are paying for it.
Perhaps the Premier and the Health Minister have already forgotten about the Ombudsman's damning report on the state of seniors' care. She heard about residents suffering because of widespread short staffing and the lack of clear standards.
Caden Cott is just 4 years old, but he's already been through far more health challenges and medical procedures than most people ever endure in an entire lifetime. The Saskatoon Health Region agrees that Caden needs to go to Denver for treatment because they can't meet his needs here in Saskatchewan. But the government has overruled that. A Ministry of Health official told Caden's mom that the government denied coverage because of cutbacks. Because of cutbacks, that's what Caden's mom was told. Well, the cost of this desperately needed treatment in Denver is just over $14,000. Mr. Speaker, the Premier's 2 travel scouts spend way more than that. On average, Mr. Speaker, these travel scouts spend almost $20,000 per trip. So even if the Premier would send just 1 travel scout instead of 2, he could easily find the money to cover this treatment for Caden.
Educational assistants are being cut, school lunch programs are being cut, busing is being cut, English as an additional language programs are being cut. School divisions say they can't even replace furniture and computers, Mr. Speaker, that are broken down.
Mr. Speaker, we see great agitation on the government benches this morning, but we see no answers. We see no explanation from the Premier about how he committed to a 7-day wait to see specialists, Mr. Speaker. Now the average, Mr. Speaker, the average wait is 10 or 11 months.
Unbelievable.
That's absolutely atrocious. This Premier, Mr. Speaker, has had years of record revenues, but instead of investing in better access to health care when people need it, they have plowed millions of dollars into the failed John Black lean experiment. Well, Mr. Speaker, John Black lean has clearly failed. What is his explanation, Mr. Speaker, as to why wait times for specialists are getting so much worse?
Immense financial pressures, short staffing, severe physical infrastructure needs, and absolutely no process or oversight for quality of care. This, Mr. Speaker, is the state of seniors' care under that government.
You know, Mr. Speaker, this is a government that says it can't even fund little Caden Cott's desperately needed treatment, which would cost just $14,000. This is the government that says it can't afford 1 extra nickel for the thousands of new students in our province's schools. And this is the government that hasn't found a way to fix ER wait times or specialist wait times or the senior care crisis. And yet the same government that has blown a massive amount of money defending a really bad law all the way to the Supreme Court of Canada.
I want Saskatchewan to follow the lead of other provinces in formally reviewing domestic violence deaths. Is the Premier open to that?
When a project goes from $400 million to over $2 billion in just a couple years, clearly something isn't right. And it's shaping up to be a multi-billion-dollar bypass boondoggle.
There is still a lot of anger about the way the Sask Party government has handled the forest fire season, about the deep cuts to fighting resources, about the policies that are too rigid, and about the lack of cooperation with First Nation Northern leaders, and about poor communication. Will the Premier admit that these are areas where his government's response was very poor?
When the new Environment Minister was asked if he believes climate change is real, he couldn't answer the question. When pushed repeatedly, he said, quote, "Those are the kinds of things that I want to talk to my officials about and find out where we're at as far as the science goes," end quote. In fact, this party has a candidate in Saskatoon who says that climate change is a myth based on, quote, witchcraft reasoning, end quote. Neither the Premier nor the Environment Minister have denounced those comments. That's how out of touch and backward the Sask Party really is. No wonder they've slashed climate change funding by 85%.
In just 4 health regions, Mr. Speaker, 4 regions, over 18,000 patients registered with a triage nurse were put on a list to see a doctor, but were left waiting so long in the waiting room that they left the emergency room. My question to the Premier, is that enough to finally get the Premier's attention?
Hear, hear.
Keewatin Yadi Health Region has a suicide rate that is 3.5 times higher than the provincial rate. Mr. Speaker, I attend far too many funerals of family members and constituents who have lost hope and chose to end their lives. We need accessible mental health services in the North. We need addiction programs, Mr. Speaker. We need to give Northern residents the hope that comes with good housing, strong communities, a vibrant economy, and lots of opportunities for education and employment.
Saskatchewan is last among Canadian provinces in terms of regulated childcare spaces. Just 12% of kids aged 5 and under have access to a regulated space. The Canadian average is 24%, more than double the rate here in Saskatchewan. This government has had almost a decade of record revenues, yet it has failed to significantly improve childcare, and that is not acceptable.
Here's what 85-year-old Jim Lawrence says. I told the head lady here one day, I said, I didn't come here to be abused or pushed around. I said, I've never allowed anybody to push me around my whole life. And I said, no, I don't want to start now, not at my age. I'm 85 years old. I don't know how much longer I've got, but I want to live in peace. We're paying good money. It's our money that's keeping the place going. But it's the shortage of money that they say is causing the whole problem. Mr. Speaker, I think this quote from Jim is heartbreaking. This 85-year-old man just wants to live in peace, just wants to be safe, just wants to have his basic needs taken care of. But that's not happening because of the Sask Party's cuts. A 32-year Navy veteran named Don Reed is also speaking out. He says, quote, now they've got such a small staff on at night that it's hard to get any help if you need it. Such a small staff that it's hard to get any help if you need it. Don Reed is a decorated veteran. He served our country with distinction, and now this government is letting him down.
We're hearing from a lot of Saskatchewan people who are flabbergasted to hear about the Sask Party's maintenance plan for the so-called Regina bypass. It just defies common sense. This plan will actually force government-owned snowplows to lift their snowplows when they reach the bypass, drive down the bypass without clearing any snow, and then allow them to start cleaning snow once again when they get to the other side. And I guess the minister texts at that time Il Neige to the Paris company to let them know it's snowing in Saskatchewan, all because of this secret deal with this corporation from Paris.
Surgeries here in our capital city are being scaled back significantly in order to cut $8 million in costs. At the same time as the government is cutting surgeries, the need for surgeries is going up. That's what the internal documents show, Mr. Speaker. They're not just cutting surgeries, Mr. Speaker. They are also cutting a bunch of full-time healthcare jobs. In fact, they are cutting 152 full-time equivalent positions. Right. 152 full-time healthcare jobs gone. After a decade of prosperity, this is where healthcare is at under the Sask Party, Mr. Speaker, because of Sask Party neglect and because of Sask Party cuts. Doesn't it concern the Premier, Mr. Speaker, that he is presiding over the elimination of 152 full-time healthcare jobs just in Regina and area?
Hear, hear.